Thank you so much, Madam Chair, for allowing me to wave on to today's hearing, and it's such an important one. I want to thank all the witnesses, and I want to give a special thank you to my friend and colleague from Illinois, Robin Kelly, who has been such a champion of this issue for our state. Illinois has been one of the most extreme pregnancy-related deaths disparities has one in the nation. According to data from our Department of Public Health, Black women are 6 times more likely to die of pregnancy-related conditions as white women. It's just totally unacceptable. And I want to say a really special thank you to Mrs. Irving, and I am so grateful that you have shared your daughter Shalon's story with us today. And I just want to add, when I read the article that was given to us, that this is a 3rd child and the last child that you have also buried. So I'm so sorry for that. I firmly believe the words of your testimony, that this disparity, quote, has to do with the appalling way Black women are or aren't attended to or listened to, unquote, and I am fully supportive of extending Medicaid coverage for the postpartum care up to from 60 days to 1 year, as the bill that we're considering today proposes, and though that will make a transformative change, that's certainly not enough. Ms. Irving, I wanted to ask you a question. Here you have this such an educated daughter in the healthcare field. She's a doctor herself. What did the physicians tell her as she continued to suffer after the birth of her daughter that somehow indicated that they must not have been hearing her?
Every time she went to the doctor's office, and there were probably at least 5 times, 3 times I know of in 1 week, each time it was a dismissive, you just had a baby, give it time, you'll feel better.
Did they do any of the tests that would have indicated what the problems were?
On the last day that she went, which was the 24th, 5 hours before she collapsed, she went in and they gave her a test for preeclampsia. But since she didn't have any blurriness of vision, they said, well, we can rule that out. And they gave her a test for blood clotting. She said, I've had blood clots. I know what they feel like. This is not a blood clot. And of course, it wasn't a blood clot. But her blood pressure was still off the roof. I think if I'm correct, it was 174 over 119. And she was sent home. And 5 hours later, she collapsed.
Well, you had also said in your testimony that essentially that no one is really immune regardless of education, et cetera, no. And that the issue of racial disparities is certainly a huge problem. I wanted to ask Dr. Howell a question. I'm interested in the idea of holding hospitals accountable for maternity care through a value-based care model. Do you believe that bundled payments for an entire episode of maternal care could give health systems more incentives and greater control to improve the pregnancy-related outcomes from beginning to end with regard to racial disparities in particular?
I think we need more work on alternative payment models to think about maternity care and incentivize clinicians and hospitals correctly. I do worry about unintended consequences, specifically that certain hospitals will be penalized if we don't do this right, in terms of the fact that they have the highest risk patients and we're not recognizing that. So I think there is a lot of work to be done in this space. I don't have the perfect solution yet because I want to make sure that we think about those unintended consequences as we move forward.
So do you think bundled payments may be one thing that at least should be explored, so that from prenatal care through the full year, maybe even issues like postpartum depression, be considered in a bundle of payments?
I absolutely think that they should be explored. I think that the measures that they would be accountable for would need to be partnered with new quality measures that are really well developed, and so that we have the right things. Some of those measures would also be targeting disparities. So if you measured the success based on those quality metrics that look at patient-centeredness and disparities, might be a promising avenue. But again, always remembering that we can't penalize those hospitals that take care of the sickest patients. So we have to make sure that we are accounting for that in our models.
We also want to make sure diversity in the workforce is there so that everyone is represented at every level of care. Thank you so much. And again, Ms. Irving, thank you so very much.